Well, new developments and potential changes with Baystate Health. The organization is looking to close their intensive care units at Baystate Wing and Baystate Noble hospitals.
There are a lot of questions and concerns tonight about this plan. Western Mass News reporter Caroline Powers joins us live from Baystate Medical Center in Springfield with the very latest. Caroline?
Dave and Beth, Baystate Health tells us that they have notified the Department of Public Health about their plans to transition these ICU beds on August 30th. That means anyone who's looking to get ICU treatment either at Baystate Wing in Palmer or Noble Hospital in Westfield would have to come here to Baystate Medical Center in Springfield.
Seconds and minutes matter for those patients.
The Massachusetts Nurses Association is sharing concerns with Western Mass News after Baystate Health announced plans to close their ICU beds at 2 local hospitals.
Some of the issues the nurses brought up were that, Noble, of course, has an emergency department and an operating room. And so those patients at any given time could require intensive care unit level of care.
Baystate Health is proposing the changes at Noble Hospital in Westfield and Baystate Wing in Palmer. Each has 6 licensed ICU beds. They plan to transition these ICU beds to medical surgical beds effective August 30th, 2019, following Department of Public Health approval. In a statement, Baystate says, as has been the practice for the past year, patients at those hospitals who need a higher ICU level of care are transferred to Baystate Medical Center, where there is a concentration of highly trained critical care specialists and a core group of subspecialists consistently available. To understand the impact of these changes, Western Mass News looked into the extra travel times for patients in need of critical care and found the 10-mile drive from Westfield to Springfield comes in at around 26 minutes. And patients would have to travel close to a half hour from Palmer to get to Baystate Medical Center.
Patients who need care closer to them, who have loved ones and people who can help them recover, but if they have to go to a farther away hospital, and this is relevant for the ICU or for the mental health units, it's going to be harder for them to recover if their support system is farther away.
This announcement also comes as Baystate is making changes to several of their behavioral health centers.
The nurses are really disappointed, especially coming on top of the announced closures of the mental health units, because the sense is that Baystate is closing these really essential services, and what's next? What is the next hospital unit or the next hospital that Baystate might seek to shut down? And that's really concerning for the nurses because they have a lot of patients who live locally who need those services.
Now, the Baystate Health says that no jobs will be impacted by these proposed changes. The Department of Public Health has set up hearings. They're holding one on June 18th to discuss the proposed shutdown of the ICU beds. That's going to be at Wing Hospital, again in Palmer. And then there is another hearing scheduled for June 19th on the possible changes at Noble Hospital. That's going to be taking place at the Westfield Middle School. We do have more information on our website, westernmassnews.com. Live in Springfield, I'm Caroline Powers for Western Mass News.